Hi, everyone. My name is Dr. Don Buford. I'm an orthopedic surgeon in Dallas, Texas. And the title of this presentation is Regulatory Compliance in the Marketing of Orthobiologics. These are my disclosures. They're available online as well. I'm going to go through a legal review. It's going to sound a lot like I'm saying no a lot, but we will try and end this on a positive note. We will go through some regenerative medicine advertising regulations and some case studies in Texas, and also some online examples. There are two main federal laws that regulate advertising. Number one is the Federal Trade Commission Act, and number two is the Lanham Act. The FTC Act prohibits unfair or deceptive acts or practices. And here's an example of how it was used in a regenerative medicine case in 2021. The FTC and the Georgia Attorney General sued the co-founders of the Stem Cell Institute of America for marketing stem cell therapy to seniors nationwide. And the bogus claims that were pointed to by the FTC in the state of Georgia were the claims that this stem cell therapy was effective in treating arthritis, joint pain, and other orthopedic conditions. There really wasn't any contention whether or not it was stem cells or not. It wasn't. But the point was they were claiming it was, and they were claiming that it was effective in a certain treatment condition. And that violates the FTC regulations, because we know that the FDA has not approved stem cell therapy for any specific orthopedic condition. When we dig a little bit deeper into the claim, one of the things that really probably accelerated the enforcement action against this company was that they intentionally targeted elderly and disabled consumers. We have to be careful here because the penalties are significant. $5,000 per violation, as you see over here in C. And guess what? If you're targeting the elderly or disabled, it's doubled, $10,000 per violation. Understand that one ad could have multiple violations. One platform could have multiple violations. So it is quite possible that the ultimate fines assessed could be in the millions of dollars, and they could be bankruptcy level numbers for a particular clinician or a group. It is very easy to file these claims. It is available online. All you have to do is Google it. There's websites available. So it is easy for your patient or your competitor or your disgruntled employee or your sales rep or really anybody to file a complaint with the FTC. So some final FTC advertising advice: anything in your advertising that claims a cure, I would just remove, whether it cures it or not. Even if it's truthful, even if you have backstopped peer-reviewed evidence, I wouldn't claim it in an advertising that covers regenerative medicine. Definitely, if you're talking about unproven treatments for autism, macular degeneration, other specialties outside of orthopedics even, then I think you're just putting a bullseye on your practice and on yourself personally to asking for regulatory enforcement. Be very careful when you use medical terms in any headlines. So using stem cells in any advertising for me is a no-no. All it does is it puts me on somebody's radar. It gives someone carte blanche to then go through my website and see what I'm doing, and to see how non-compliant I am, and to see where to place me on their list of companies that need to be investigated. So the Lanham Act is a little bit different. This also prohibits trademark infringement and trademark dilution, but the key for us in regenerative medicine is it also addresses false advertising. There's a little bit of a slant to the way a Lanham Act claim works. This is not something that's filed by a consumer against a company. What's interesting about this is the plaintiff in a Lanham Act is a different company, another company, typically a competing company. So for example, if I am in practice and somebody down the street from me that does the same thing that I do has marketing out there that says that they're better than me, or that says, even if it's not directly relating to me, if they say that they have a treatment that is the most amazing thing since sliced bread, if it's false and clearly false and has no data, as a competitor, I can file a Lanham Act claim, because what they are doing is misleading the public and materially affecting my business. Now, I am not an attorney, so do not take what I say as gospel. Please get with your legal people and look at your unique situations. But just know that this does exist, and this has been used in this business, where companies have claimed harm from a competitor company because of false advertising and false claims. Advertising board certification is another area that we have to be careful as clinicians. Obviously, if you're not board certified and you advertise that you are, somebody's going to figure that out at some point. However, it gets a little more nuanced if you have a board certification from a board that's not one of the 24 medical specialty member boards. And if you look at the boards listed in red, you notice that pain medicine and interventional pain is not listed. It's not one of the 24 member boards. So if this was the end of the story, you cannot advertise that you're board certified by the Board of Pain Management or Pain Medicine in the state of Texas. However, there is a loophole. There are 6 or 7 boards that are not part of ABMS that have been granted a dispensation to be used as board certifying entities in advertising. And if you look at this list, now you see the American Board of Pain Medicine is on there, and you see that the American Board of Interventional Pain Physicians is on there. So if you're certified by one of those 2 boards, which is relevant to this meeting, obviously, if you're in Texas, you can say, I'm board certified. This is relevant in the regenerative medicine world because there are some entities and organizations granting certification if you go through their coursework. And the problem with that is not the certification. That's fine. And congrats on doing the work. The problem comes with advertising it. If you advertise that you're board certified with one of those organizations' certifications, and it's not one of the extra 6 listed on the last slide, you cannot advertise that you're board certified. So what about competitive advertising? Well, I think it's pretty simple. You shouldn't make any claims for which you don't have absolutely rock solid, non-controversial data readily available. And the bar for that for me is extremely high, meaning that based on myhealthgrades.com reviews, for example, if I say that I have over 600 5-star ratings in an advertisement, that's fine. But I wouldn't say that I'm better than my neighbor down the street who only has 520. I wouldn't say that I get better outcomes because of that. You can't make any of those types of claims without rock solid data. Even if I patented a procedure, I wouldn't say that it's better than a competing procedure if the only paper out there is my white paper or a publication that I wrote that I paid to have published. So you have to be very, very careful. It's just not worth the risk. And you can say that you do a nice job taking care of people and you're well trained, and that should be enough without going to some claims that aren't sustainable. Testimonials are another area where we can get into trouble. You have to be careful. This is a typical testimonial page from a website. All of these patients may rant and rave about how fantastic they did. The problem is the patient's message is your message. So if the patient is on a testimonial saying that you treated them with IV stem cells for their macular degeneration and their autism, and they got better, and by the way, their diabetes got better too, that's going to rocket you up to the top of the enforcement ledger, right? Patients' claims on testimonials are often basically taken as if you're making those claims yourself. So at the very least, have a disclaimer saying that the results noted are not typical and not meant to represent standard results. But sometimes if the claims in a testimonial are truly extraordinary, your disclaimer won't be enough to protect you. Google changed their advertising policy a little over a year ago now, but they had started this policy about 2 years ago, where any ad that uses the term stem cell therapy, gene therapy, or even platelet-rich plasma, and in a lot of cases, even regenerative medicine, those ads get dinged and they're not accepted on Google. And it goes even deeper than that because Google has some algorithms apparently that even though your ad may be compliant where you don't use any of the bad words, if your website has the bad words on it, and that could be as simple as PRP, then they still may not accept your ad. So one potential strategy for that, because Google's important, patients go to Google to find doctors and to find treatment alternatives. One potential strategy is your patients that review you, especially on Google, can say whatever they want. And so here are two examples from my reviews where I didn't know that these patients were going to review me. I didn't know how many stars they were going to give me. I had no idea what they were going to say. And on the left, Connie was kind enough to say that her left knee responded well to stem cell injection. I didn't say that she had a stem cell injection. In fact, in my practice, I talk people out of using that term even. We talk about bone marrow concentrate in my practice. Patients hear stem cell though. And so by her putting that in her review, that's a searchable term in Google's algorithms. And so here's a way for my clinic and my name to be associated with that, even though, again, I'm talking people out of using that term, but at least it puts me into the system and ties my practice and my name with regenerative medicine, with stem cell. In the review on the right, it ties my name to PRP therapy, and it ties my practice to PRP therapy. And so by that simple act of a patient writing a review and using those regenerative medicine terms, that can move your practice up when people look for particular things in a particular area. And here's an example of that. Now, this is just a Google search done today using the term Dallas stem cell. And you can see there's 3 that come up. These are not ads, these are not paid, but these are just 3 organic results. And my practice is number 2. This is very interesting because only the top 3 come up. 2 of the 3 are my practice and the RegenX affiliate in Dallas. And neither one of us talk about stem cells in our practice, neither in our advertising and websites in a way that's non-compliant. Neither one of us talk about using stem cells for stroke or multiple sclerosis or traumatic brain injuries or Parkinson's. And yet we still come up in the top 3 because our patients give us reviews where they mention that they had that therapy. Innovation Stem Cell Center is a little bit different. They come up, in my opinion, they come up very highly because look at their website. They use stem cell in their website. It's obviously it's part of their name. But here's where they're going to be in trouble potentially, in my opinion. They are listing a list of treatments for which there is no indication for stem cells from the FDA. And they're just really asking for some regulatory body, whether it's the local district attorney, the state district attorney, the attorney general, the FTC, the FDA, that there's really a list that's probably 10 strong of people that can go after a clinic that's advertising in this fashion. So I would be very careful doing that. So some quick examples. Again, just eliminate stem cell therapy from your advertising. Just take it away. It's not necessary. You can talk about orthobiologics. You can talk about minimally invasive options to surgery and to steroids and to narcotics, but eliminate stem cell therapy from your advertising at this point. If you say that you're treating conditions, you have to be very careful. I know a lot of us that are very thoughtful and very concerned will still have things on our websites and on our advertising that say that we treat arthritis with PRP, for example. And we have the evidence to back that up. So I don't think that's wrong to say that, but just know that there's not an FDA indication for arthritis for PRP. So we have to be careful. Now, I haven't seen any regulatory action against any clinic or doctor if that was the only thing they said. So there usually has to be something else much worse before you rise up on the list to be the subject of enforcement action. So this is one way to do it. This is from the Cleveland Clinic, which has an interventional orthopedics division now. They don't talk about using stem cells. It's a very informational, very educational write-up. They do talk about interventional orthopedics. They talk about it being minimally invasive. They talk about how it can treat. Now, this is, again, you have a little bit of a gray zone, right? Because they're treating tendinopathy and some other orthopedic conditions. But this is, I think, safe. And if you need some verbiage that's safe to use in your marketing and advertising, I would go to an academic center like Cleveland Clinic, potentially Emory or Stanford or Rush or someplace that has a regenerative medicine public-facing website, and look at the verbiage that they've used, because odds are it's been vetted by a conservative healthcare attorney, and that would be where I would start. So once you have that, and once you're comfortable then you can do your happy dance, you can promote yourself, promote your practice, you can sleep at night knowing that you're not, an egregious violation of some statute, and you can still put the word out that people need to come see you for alternatives. So thank you very much. I appreciate the opportunity to be part of this meeting and look forward to talking a little bit more tomorrow.